Welcome back to the Deep Dive.
Great to be back.
Our mission today really is to give you a shortcut to understanding one of the most high-stakes arenas in modern IT.
Absolutely.
We're talking about the essential infrastructure that supports electronic health records, or EHRs. Specifically, we're diving into this critical partnership between HPE and Meditech, looking at the HPE GreenLake Flex solution.
Right.
And the stakes here are just phenomenal. We're talking about patient records that have to be available 24/7, 365.
No exceptions.
Right. And data is always growing. So the pressure on hospital IT to just keep up while keeping everything secure and, fast, it's immense.
It is. That's the core challenge. Modern healthcare demands zero downtime and instant data access.
Yeah.
The old way of doing things.
Throwing a ton of hardware up front?
Exactly. Buying massive hardware and just hoping you guessed your future needs correctly. That model is just breaking under the pressure.
So what's different here?
Well, what's unique is the collaboration. It's about delivering an extremely reliable platform using a fundamentally different approach.
The GreenLake model.
The GreenLake model. HPE calls it a cloud operating model.
Okay, what does that actually mean in practice?
It means you get the agility and the pay-per-use economics you'd expect from a public cloud.
But it's not in the public cloud.
Right. And that's the key. The infrastructure is actually implemented right inside the customer's own data center.
Or a co-location facility they trust.
Or a colo, yeah. So you get that private cloud control, but with public cloud economics.
Okay, let's really unpack that. For a hospital, this shift from, a big purchase to an as-a-service model, that's a huge deal.
It is.
How is it really different from, say, just a traditional lease? Where does the cloud magic come in on the budget?
That's a great question. Because on the surface, it can look a bit like a lease. But the real difference is operational efficiency and risk mitigation. In a lease or a big CapEx purchase, you size your infrastructure for your peak needs 5 years from now.
Meaning you're paying for server racks today that are just sitting there empty.
Exactly. It's wasted capital.
Yeah.
With GreenLake, the capacity is installed, it's there, but you only pay for what you actually consume.
The virtual machines, the storage.
The VMs, the gigabytes of storage, yeah. That minimizes the upfront capital hit and turns IT costs into a predictable, flexible OpEx expense.
So if a new clinic opens or patient volume spikes,
they can scale up instantly. No need for a massive new budget approval cycle.
So the hospital isn't betting its balance sheet on a prediction 5 years out. They're just consuming what they need right now.
That's it. And that financial flexibility is matched by operational agility.
Because it's on-prem, they still control everything. Data, security.
All of it, which is non-negotiable in healthcare. They could adapt to regulatory changes or data shifts, all while HPE's support and proactive monitoring is just, baked into the service.
So it sounds like they're buying an outcome. An operational result, not just a stack of hardware.
That's a perfect way to put it.
We should probably touch on that service wrapper because that's a big part of as a service. What's included beyond just the metal?
It's really end-to-end, but maybe more importantly, you get advanced metering. It tracks your consumption in real time, and that's what drives the billing.
And the support?
Oh, yeah. The design, the install, configuration, and proactive complete care support. It's all covered. Guaranteed collaboration.
So it takes the burden off the hospital's IT staff.
It does. It frees them up to focus on the actual clinical applications and supporting the doctors and nurses.
Okay, that covers the financial and management side. But, reliability really comes down to the architecture. Let's get into the brass tacks. Yeah. What's actually powering this hybrid cloud platform for Meditech?
Right. So if we look at the architecture, the compute layer is built on HPE ProLiant servers.
The DL360s and 380s.
Yep. The industry workhorses.
Yeah.
But the really essential component, the part that dictates performance for Meditech, that's the storage.
And that would be?
That's the HPE Alletra Storage MP B1000 system. Meditech has very specific requirements for storage that can handle massive patient record systems with guaranteed uptime. This is the platform chosen to deliver that.
And what's the glue between the application and the hardware?
That's the virtualization layer, VMware, vSphere. And then to ensure resilience, you've got a whole data protection strategy using HPE StoreOnce for the backups and Commvault to manage all the data movement.
It's a full stack then, engineered for this specific purpose.
It is, for continuous availability.
Now we get to the really high stakes part. We know this whole setup has to be validated. Certified. And when Meditech certifies a storage platform, they're not just, running simple benchmarks. They are simulating peak operational stress. What are their non-negotiable standards?
You're right. This is not generic IT testing. This storage platform, the Alletra MP B10000, it's designed for environments where a delay of even a few milliseconds could impact patient care.
Wow.
It's actually the industry's first disaggregated scale-out block storage that comes with a 100% data availability guarantee.
100%. Okay.
The certification really focuses on two things, throughput and latency. For throughput, they test at two high levels, 45,000 IOPS, and then the highest level, 80,000 IOPS.
IOPS being input-output operations per second, a measure of workload?
Correct. But the real curveball is that you have to maintain ultra-low latency while you're running backups and disaster recovery processes at the same time.
So what are the actual latency targets under that kind of stress?
They are brutally tight. For reads and writes, latency has to stay below 1 millisecond.
1 millisecond.
1 millisecond during what they call the Integrated Serverless Backup, or ISB. And it has to stay below 2 milliseconds during Integrated Disaster Recovery, or IDR.
Okay, let's define those terms. When you say ISB, Integrated Serverless Backup, what are we talking about?
So ISB is your fast, daily, application-consistent backup. It uses the storage array's native snapshots and copies that data directly to the backup appliance.
Taking the load off the main application servers.
Exactly. And IDR, that's the process that creates and maintains those frequent local snapshots, maybe every few hours.
For a quick recovery if there's a smaller issue.
Precisely. So they're testing for speed and availability at the exact same time.
Got it. And then there's the truly stressful metric, the one that actually impacts the user experience, the time crunch.
Yes. This is the moment when the database needs to be guaranteed consistent so it can take that snapshot. To do that, the system briefly enters a state of quiescence.
Quiescence. Okay.
Think of it like this. All the input and output from the clinical apps to the storage, it just halts for a moment.
And Meditech has a hard rule for how long that moment can be.
A very hard non-negotiable rule. The copy creation time, the time the database is frozen, it must be less than 8 seconds.
And if it's longer?
If it's even a fraction longer, users start getting errors. Nurses trying to update patient charts. Their application just hangs or times out.
So 8 seconds is the difference between a smooth workflow and clinical chaos.
That's the line in the sand.
How did they set up the certification test to replicate that kind of high-stress environment?
The certification was done in the HPE lab. They simulated a pretty big deployment using 4 ProLiant servers to host 20 virtual Meditech hosts.
And those 20 hosts were generating the workload.
They were generating that constant 80,000 IOPS workload. And crucially, they did it with deduplication and compression turned on, which is a real-world scenario. You want the data reduction, but it absolutely can't compromise that sub-millisecond performance.
So the big question, how did the Alletra system do when they pushed it to that 80,000 IOPS limit while also running those backup and recovery jobs?
It was a clear success. The system didn't just meet the metrics. It handled that top-tier 80,000 IOPS workload with very consistent performance.
And the latencies?
Well below the 1 millisecond for ISB and the 2 millisecond threshold for IDR. Right through the whole test.
That's impressive for performance, but the make-or-break metric is that 8-second copy creation limit.
It is.
How did they make sure 20 separate databases could be paused and copied without crossing that line? Because doing them one by one sounds like it would take forever.
Right, and that's where the smart engineering comes in. It solves a really fundamental scaling problem. Instead of firing off 20 separate commands, one for each volume,
They did something else.
they use a feature called volume collection groups, orchestrated with Bridgehead software.
Volume collection.
Think of it like being able to save 20 different Word documents at the same time with a single save all command, instead of clicking save on each one.
Okay, that makes sense.
They assembled all 20 of those virtual volumes into a single application-consistent set. This lets the backup software issue one single coordinated command to the storage array.
So by treating all 20 databases as one unit for the snapshot, they shrink that freezing time. What were the results?
Exactly. By using volume collection, the average copy creation time was kept dramatically low, well within that critical 8-second limit.
So no impact to the users.
No noticeable performance impact to the clinical users at all, even during backups. It proves the platform is truly designed for continuous clinical use.
Let's just quickly touch on the backup logistics then. What was the frequency of these processes during the test?
So the IDR snapshots, the fast local recovery points, They were scheduled for every 6 hours and kept for 24 hours.
Okay.
And the more comprehensive ISB, the serverless backup, that happened daily. It took the latest snapshot and copied it over to an HPE Store 1 appliance. That whole process for all 20 volumes took about an hour.
An hour for a full backup is pretty quick.
It is. And an interesting little detail from the testing, they found that for optimal performance, they had to set the concurrent backup streams to exactly 14 when dealing with those 20 servers.
Wow. So that's the level of fine-tuning needed to meet these SLAs.
It is.
And the final word on certification, was it across the board?
Yes, full certification. The HPE Alletra MP B1000 achieved it for the entire Meditech ecosystem, including the traditional 6.X and the new Expanse platforms. It's certified for the largest, most essential deployments.
This whole deep dive really shows that achieving modern healthcare IT standards it's less about raw speed and more about engineered availability and flexible scaling and maintaining that extreme low latency sub 1 millisecond, even when massive data operations are running in the background.
That's the key.
So what does this all mean for you, the listener?
I think it means that the continuous flow of patient care really does rest on the reliability of these incredibly sensitive infrastructure components. The whole testing process, especially that focus on the tiny 8-second window for a snapshot, it shows that performance validation in this world is about proving usability under fire.
Right.
The success here is that the HPE GreenLake and Meditech platform can manage that risk. It makes the storage, invisible and instantaneous to the clinician.
That perfectly captures the stakes. Which leads to the final provocative thought we want to leave you with.
Go for it.
Consider how the ability to adopt cloud economics, that power to pay only for the resources you consume, how that fundamentally changes the calculation for big IT investments in healthcare. It moves you away from the immense risk of massive upfront capital spending.
To a flexible operational budget that's built on guaranteed certified performance.
Exactly. That ability to match your costs directly to your consumption, that might just be the most important innovation of all.